A key requirement in caring for people with MS is obtaining accurate information about their clinical status. We are in the process of implementing a novel, innovative way of obtaining that information using iPad applications to do that.
So it's important for patients to know that they have a medical appointment time with their clinician, but prior to that, part of their care is meeting with a medical assistant and also doing that multiple sclerosis processing test prior to their medical appointment.
And the new structure involves a 3-stage appointment. So when a patient sees their appointment time in the MyChart system or gets their appointment reminder in the mail, that time that they see is actually the beginning of a 3-stage appointment, which includes the 20-minute visit with a medical assistant, a 30-minute visit for neuroperformance testing, followed by the regular 45-minute visit with your provider as it's always been scheduled.
When the patients first arrive, they check into the front desk and the medical assistant comes out to greet them. The medical assistant will take their vital signs, review medications.
The second stage of the visit is the multiple sclerosis performance test. The Multiple Sclerosis Performance Test, or the MSPT, is a series of questionnaires and neuroperformance tests that the patient will perform on an iPad at the time of each of their follow-up visits at the Mellen Center. The MSPT consists of 4 different performance test modules. The walking speed test, a lot of patients will recognize because we've been doing a timed 25-foot walk here for a long time. The manual dexterity test is similar to the 9-hole peg test that we've always performed.
There's a cognitive or memory test. There's a vision test as well. And then there are questionnaires that assess a patient's quality of life, their ability to function, their fatigue level, and their mood. Patients who have gone through the MSPT testing are very positive about it.
The test is super easy. Everything is self-explanatory. I mean, it just comes up on the screen and you know exactly what to do.
Overall, I've collected a lot of good data. You know, I have a level of how I think I'm feeling, which is more qualitative, but the quantitative aspect also helps provide a bigger picture of how I'm doing.
Using the MSPT on the iPad, we might pick up on changes even before a patient would notice that there are changes happening with their cognition, with their vision function, or with their walking. We're acquiring new information that we've never had before.
That information is available to both the clinician and the patient at the time of the visit, so we can review the results to make informed treatment decisions. We also have information from previous visits, so we can look at trends over time, whether someone is improving, staying stable, or getting worse, and we can then use that information to adjust their treatment plan.
I felt like it was a good process. My hope is over time that I'm going to stabilize, and these tests will help show that.
I have a sense of security that they know what's going on with my disease. Things that I might not notice that would come out through the testing. So that gives me a lot of confidence that they're getting the information they need to take good care of me.
Even as patients with MS notice a few changes in their visit structure, some things about the Mellen Center are never going to change. You'll always get plenty of time with your care provider. What is most important to the patients is always most important to us, and they're really on the cutting edge of care for MS.